With more people applying for unemployment, more families are struggling to get food on the table. The Washington, D.C. area is seeing higher than average unemployment, and that's creating overwhelming need at local food banks. NBC News reporter Ali Vitali joins us now from Arlington, Virginia. And Ali, you're at a church that's turned into a food pantry. What have you been seeing there today?
Yeah, Allison, for several hours this morning, hundreds of people stood on the sidewalk behind me and were able to pick up bags of food at this food pantry. This is something that the church here does every Wednesday, and they say that their demand has been higher than ever since the coronavirus pandemic started. You mentioned those unemployment statistics. That may be one reason why people are showing up here and to other food banks across the D.C. area. Food pantries in this area say that they've seen anywhere from a 30 to 400% increase since this pandemic began in demand for their services. Even just here at Our Lady Queen of Peace, they've seen a 96% increase in demand. So a lot of new people coming to their doors, in addition to regular folks who they've seen coming for years. And in talking to the pastor here, I asked him what the most frequent thing he's hearing from those people who are coming here for the first time. I want to play for you what he told me.
They don't know how to answer their kids when their kids ask them, what are we going to have to eat tonight?
It's really hard.
Those are the heartbreaking things. Yeah.
What do you tell them?
We tell them that we are going to continue to do everything we can to make sure that they can feed their kids tonight.
And Allison, I met those people here too as I was staying and standing around them while they were waiting in line. I was talking to a 14-year-old boy who was here with his mom, who was saying this is the first time they've had to come out to a food bank and how hard that was for him. And you can see it on his face and the other folks who were here in line that this is a hard new reality for so many people who are now finding themselves out of work during this pandemic. I think the thing, though, that stuck with me is in talking to a volunteer here, in talking to the pastor here in this church, really the idea of hope and the way that this community is trying to rally around its neighbors in need, give them the food that they need to bring home to put on their tables, and just try to come around them in a really, really hard moment, lifting up the people in this community who are struggling right now. And so, as the pastor told me earlier, as much as this is a heartbreaking moment to see these numbers of people skyrocketing in lines like this, at the same time, it's a sign of hope that their neighbors are here to hopefully lift them up and keep doing so.
Absolutely, Ali. We know grocery stores around the country are reporting some shortages as well, and that's definitely having an impact on the food pantries. How are they trying to meet the demand for food while they're dealing with that?
Well, you also have to just think of the supply chain for these food banks. Food banks are the central entities that then supply the food pantries and soup kitchens around this area. In talking to the Capitol Food Bank CEO, she was saying that about 60% of their food input comes from grocery store retailers and bigger stores like that, which now, you know, you've probably been to the grocery store recently. You see those picked over shelves, empty shelves. That means that there's less for those grocery stores to give to the food banks, and by proxy, less for the food banks to give to the food pantries. I want to show you what one of the CEOs told me today about that shortage and how they're dealing with it.
This increase in demand has come against a backdrop of declines in food supply. So in a typical month, the food bank would receive about 60% of its food from retailers and wholesalers. So this is food that's donated. We saw a dramatic reduction, 75% reduction in the food donations that came to us from retailers.
And so, Allison, what they're trying to do now is order food in advance. Hundreds of truckloads of food is what the CEO said to me. But at the same time, just because they're ordering it doesn't mean that it's coming immediately. We also know from just going to the grocery store, there's a lag time between when these grocery stores run out of food and when they can replenish. The same thing goes to the food banks that are trying to keep enough food in stock to feed all of this demand that they're having from soup kitchens and parishes. And so while they're trying to meet that demand, they're also having to go to the community and ask for more donations of food and money. And so they're really planning for the long term here, because the notable thing is that as much as the politicians and the states are on their timeline for the coronavirus, the food banks are on a completely different timeline, because they know that even though some of these states start reopening, people aren't just going to be going back to work the next day. They know that this is a long-term problem for them. They say they're planning on it being a problem for about a year.
Ali, one quick question before you go. I know a lot of people watching this are probably thinking, I'd really love to help. How can I? Is there something the food banks or food pantries are telling you that they prefer? Is it food over money or money over food? Is there a best way to help?
Look, I think it's both, Allison. I think the simple answer is just donate what you can. If it's money, that means the food banks can go out and buy what they need. If it's just donations in the form of food, that also works, especially in your local community. If you're coming to places like the parish that we're at today, they said that they've seen a large outpouring from the community around just neighbors trying to help their neighbors who are struggling in this hard time. But yeah, the key is, Allison, for anyone who's watching and wants to help, donations in any form that you can give them.
Amazing. Ali Vitali, thanks so much. Always great to see you.
Thanks.
French scientists are testing a hypothesis that nicotine can help fight the coronavirus. NBC News correspondent Tessa Arcilia has the latest on their plans to do a human trial using nicotine patches.
Well, Allison, it sounds counterintuitive, it is controversial, and it's definitely caught the attention of the WHO. They're going to be reviewing this French study along with 14 other studies. They've set up a panel of experts. Now, French researchers have found a lower infection rate among COVID-19 patients who were smokers versus non-smokers. So 5% of COVID-19 patients smoked, while 25% of the general population smoked. I spoke to the neuroscientist who reviewed this study, and he said this is how it works. They think that nicotine and the COVID-19 virus try to go for the same cell receptor, and the nicotine is able to block the virus from attaching itself to the cells. So this is the hypothesis they want to test. How are they going to do that? They're going to have nicotine patches used on healthcare workers and patients. Now, the French government's already limited the sale of nicotine products to prevent stockpiling by the public. So I asked the WHO about this, what they thought, and they said they still need to look carefully at the study before coming to any conclusions.
We have evidence that, so from the other 14 studies that say that the risk of having a severe procedure of COVID is at least twice as high, right? So so that you actually will get to the ICU because you're a smoker. You have a double risk at any of the age groups. I mean, I could be surprised.
I also spoke to another public health expert who said that despite the controversy around this, it's still worth looking into.
Researchers all over the world are trying to repurpose medicines, and nicotine replacement therapy is a medicine, to treat COVID. There's data from the US, China, France, and other countries that suggest there are relatively few smokers who develop the disease if they come into contact with the virus. And we know there's a potential biological mechanism for that. So it's plausible, who knows, that nicotine might have a protective effect. But we certainly don't want to send the message that people should keep smoking.
Now, this is an important point to note. All the experts that I spoke to said this is by no means an encouragement to smoke. Smoking is still a major killer around the world. And they're also saying, do not try those nicotine patches on your own. Allison?
Two different studies out today giving mixed messages about Remdesivir's potential as a coronavirus drug. NBC News medical correspondent Dr. John Torres is here to walk us through them. Dr. John, tell us about these two studies and what they found.
So one study, Allison, it showed that there actually is some benefit from Remdesivir. That's that drug that was originally made for Ebola, and now they're starting to use it here, or look at it here, and trying it on a compassionate basis, but we didn't really know how well it would work. Earlier, there's a study that was leaked and came out of China that was also released today, and it showed it didn't work very well for patients who were critical, who were very serious with this disease. And as a matter of fact, it didn't save that many lives, if any at all, when it was compared against a placebo. But now you fast forward it to a trial that was done here. It was a double-blind, placebo-controlled trial, which is the state-of-the-art of trials. And what they found out is it actually did a couple of things. One, it cut down the time period that people suffer from coronavirus. It went from 11 days to, it went from 15 days of people who didn't have the drug to 11 days of people who did have the drug. But more importantly, it also cut down on mortality rate, on the amount of people that died from it who were on Remdesivir. 11% not on Remdesivir ended up dying because of coronavirus. 8% who were on it ended up surviving. So it's showing some good results on one hand, but on the other hand, again, in that China study, it's showing that once they get it at a critical stage, it doesn't seem to help much. So I think the bottom line here is what we're learning is the earlier it's given, the better. And if it's given early enough, it seems, at least in this small study, like it's going to give us some good benefit. Studies will continue to go on. This is not a medicine you can get a prescription for. It's an IV drug that's given in the hospital. But I think you're going to see it given earlier and earlier, and I think it's going to help out more and more.
Dr. John, yesterday the CDC released some new statistics that suggested the coronavirus death toll is higher than what's been reported. The official death toll reported in the U.S. is more than 58,000. What is the CDC saying here?
So what the CDC is saying is there are some deaths out there that were not being accounted for, and they started accounting for those deaths, and they found out that it's much higher than what we originally thought. I'm not sure this is a big surprise to a lot of public health officials and a lot of experts, because they were saying there are probably more people dying out there that aren't necessarily getting to the hospital, people possibly dying from other things as well, increasing that death rate that might be partially contributed to coronavirus. Right. And so that death rate is a little higher than we thought it was. But again, I don't think this is a huge surprise to a lot of experts and public health officials because they've been keeping a close eye on it. What it's doing more is just telling us we need a better understanding of what's happening in our communities and a better way of tallying not only the cases but the deaths as well, so we can tell, number one, how fast it's spreading, but perhaps even more importantly, if what we're doing is keeping it under control, Allison.
Dr. John, there has been a lot of hope riding on antibody tests and possible immunity. Today, Congress is saying, though, that some of those tests might not be accurate. Can people trust the results of these antibody tests?
And Allison, it's not just the Congress, but even the World Health Organization this last weekend came out with a statement saying when it comes to antibody tests, you want to slow down a little bit. You want to be very, very careful for a couple reasons. One, these tests are typically not FDA approved. Some of them are authorized under emergency use authorization approval, but they haven't gone through the typical FDA approval process, which can take years. And since this virus is so new, we really don't know that much about it, so it's going to be hard to get good testing down. So some of those tests might actually show what we call a false positive, meaning that it tells you you're positive, it tells you have antibodies when in fact you don't. They're also saying that some of these tests have not been approved at all, even for emergency use. You have to be careful of those. But the other thing they're saying, equally importantly, is we don't know what having high levels of antibodies means. Does it mean you have protection? Possibly. How long does that protection last? That's the big question we don't understand, and that's what we need to understand going forward. The longer we have coronavirus, the more patients we have to study, the better these tests will get. But for right now, it's a good test for public health purposes, again, to find out what's going on in the community. But for people who get tested positive and somebody tells them they have antibodies, this is not their excuse to go out and say, I don't need a mask, I don't need to social distance. They still need to protect themselves and their community by doing all those things.
We're also getting some new information about kids and coronavirus. There are reports that some kids are developing an inflammatory condition. What is it? What's causing it? And what should parents know here?
So it's an inflammatory condition of a couple of different things, and one of them is inflammatory conditions of the brain, where the coronavirus gets into their brain, or the inflammation part of it does, and can cause some issues there. But they can also get this thing called a cytokine storm, which is basically the immune system kind of goes into overdrive, and it causes it to attack the own body, and that can be an issue. We're seeing more children with this, and if you remember, we even talked about this a few months ago, that children seem to be protected from coronavirus. We still think that's true for the most part, but since the numbers of people getting coronavirus are climbing higher, we're also seeing more children in that group of numbers, and that means that more children are going to be affected. When children get affected to bigger numbers, we're going to see larger numbers of them getting severely affected, and unfortunately, some have died because of it. So I think that's what we're seeing here. Overall, children still seem to have some protection value from coronavirus, but we need to be equally safe with them as we are with adults, even our elderly adults, and do the things we know that keep them safe and keep them healthy. That's social distancing, hand washing, all those things we know that we all need to do, Allison.
All right, Dr. John, those same tips, they still hold true. The things you need to do, like you said,
they do.
That distancing, that hand washing, that covering your mouth. I think we're going to be doing that for quite a while. Thank you so much. And we miss you. It's been so long since I've seen you in person. I hope you're doing all right.
You bet. And we'll be back there again in person.
Oh, I hope so. Can't wait. Thanks.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.